Mr. Customer, let me make sure that I understand everything that you've shared with me so far. There are a number of challenges that you're currently facing in your occupational medical program, one of which was a significant increase in injuries, and that's affecting your downtime in getting the patients back to work in a timely manner so that you can be at full productivity. Also, you're not properly being kept in the loop when you do have injuries so that you can understand exactly what's being done with your employee and where they are in that process. Would you say that that's fair to say that those are your two main concerns right now? Excellent. Well, earlier today I shared an overview of who Concentra is and some of the services that we do provide. What I didn't share with you is some of the exciting things that we've had going on at a company, sort of an evolution that we have gone through, in taking a look at ourselves and asking a very important question that we don't feel was being asked, which is, what does a world-class occupational medicine program look like? Effectively, we didn't know because we had never asked the question, and frankly, neither had anyone else. So what we did was we set out at that point to answer that question, to find what world-class would truly look like and then achieve that goal. The first thing that we did in trying to achieve that was to reach out not only to our customers through customer engagement surveys and customer luncheons, but also to reach out to experts in the field, as well as other companies who dealt basically solely with customer service, to see how they were properly serving their customers. And what we found were that there were 10 must-haves to truly building a best-in-class, world-class occupational medicine program. And today, coincidentally, actually, you have actually mentioned a couple of those 10 must-haves, and they are the focus on employee health and patient experience, as well as a structured and managed communication process. Let's look at the first one, the focus on employee health and patient experience. What we found, as the experts have said, is that when a doctor's experience can match with getting the employee back to work, both the experience and the outcomes dramatically improve. When you talk with the doctors at your current provider, what do they communicate to you in terms of focus? Well, I can't speak on behalf of them, but it may be something that you want to address next time you speak with your provider. And that sort of leads me into the second point that I would like to discuss, that the experts had mentioned, what would be an elite program, is that structured and managed communication process. When you're entrusting your employees to Concentra or any other provider, you have a certain level of expectations as to what you want to see happen. And you need a way to understand whether or not that you are getting, in fact, what you need from that program. So what we have enacted here is several systems to be able to get to those ends. And these kind of being the drivers we call the 4 keys to help us kind of establish that best-in-class program. Now, the first key I think that it is critical for us to address here is going to be patient engagement. From the moment that your customer steps into Concentra, we're going to do the best that we can to kind of ease their mind, as well as start getting them in a mindset of becoming healthy and being better again. We pride ourselves in having a welcoming facility. Your employees will be welcomed every time they walk in. We will make sure that they understand what forms they need to fill out. But basically, right off the bat, they're going to be welcomed and given the proper kind of bedside manner that you really would want to see. Now, the other tenet of that patient engagement piece is also making sure that your patients understand exactly what needs to be expected from them to make sure that they are, in fact, part of the process in helping them self-heal. Here at Concentra, we take what we call an industrial athlete approach to bringing these people back into wellness and back onto the job as you need them to stop having that downtime. Now, the second point, also, besides patient engagement, that I want to talk to, the other key was clear communication. It's one thing to treat the patient. It's another thing for you to kind of be kept in the loop. Both of those things are of absolute pinnacle importance. If you don't know exactly what's going on with the employee that you have sent to us, then you're not going to know, what kind of time frame to expect. What's going on as far as what treatments are being given. How long can I expect that my employee is going to need to follow up with things like physical therapy? What are the next steps? And if you're not getting that currently from your provider, that's also something I would recommend that you address with them. This information, it starts with us the first day that we see your employee. You have direct access to our doctors. Dr. Walker at Kirby, absolutely, world class when it comes to handling occupational medicine, and frankly, one of the most engaging medical practitioners I have ever been around. He after the first check, he's going to provide you some information after that first injury visit to let you know what he's seen and what the steps are then going forward. From that point onward, our center medical directors, as well as our director of physical therapy, will be open to you to find out exactly what steps have gone on with it and where we are in the process of making sure that you understand exactly what's going on there. Some other communication pieces that we have in that clear communication piece are also some our injury status reports that you will be given to let you know on black and white in report format to be able to see exactly what is going on there. Also, we offer some other reports that will allow you to see exactly how much you are spending us and in what areas, what kind of injuries we are seeing. And how often, and that what that basically does is offer you some report cards as to are we delivering the things that we say that we are going to deliver to you. So, Mr. Customer, do you feel that I have addressed the two most critical components for you today? Excellent.